WNYC Studios is supported by Wise. Wise, the smart way to manage the currencies you need around the world. With the Wise account, you can send, spend, and receive in up to 40 currencies with only a few simple taps. Be smart. Get Wise. Download the Wise app today. Terms and conditions apply.
It's the Brian Lehrer Show on WNYC. Good morning again, everyone, as we continue with this year's Health Convening. If you're just joining us for this and didn't hear the first segment, every year WNYC hosts a Health Convening with support from the Alfred P. Sloan Foundation. The convening has typically been an opportunity for healthcare experts and practitioners to inform WNYC's health reporting in an off-the-air briefing and interaction. This is the third year that we're bringing it onto the air, as we've all decided it'll be a service for you to hear the briefing too. This year's focus is on ultra-processed foods. You may have just caught our conversation with Dr. Kevin Hall, former senior investigator at the National Institutes of Health before the news, whose study linked ultra-processed foods to obesity. Now we'll take a different tack and look at how some of these kinds of foods are correlated with an increased risk, specifically of colorectal cancer. Colorectal cancer is now the leading cause of cancer death in Americans under 50, with cases in that age group rising 3% per year, according to the statistics that have been published by the American Cancer Society's Colorectal Cancer Statistics 2026 report. Our guest for this part of the conversation is Dr. Fang Fang Zhang, a cancer epidemiologist, M.D., Ph.D., and chair of the Division of Nutrition, Epidemiology, and Data Science at the Friedman School of Nutrition Science and Policy at Tufts University. In 2022, for example, she published a landmark study that found that men who consumed the highest levels of ultra-processed foods had a 29% higher risk of developing colorectal cancer. Women, different, and we'll get into it. Dr. Zhang's research has helped shape our understanding of why what we eat and how it's processed may be driving that trend. Dr. Zhang, thanks so much for some time today. Welcome to WNYC.
Thank you, Brian. I'm glad to be here.
And wondering, listeners, as we get this conversation going, if any of you were diagnosed with or know someone who has or had colorectal cancer, and what conversations they were having or you were having with your doctors and care team about diet. Did it come up at all? If you had an early onset scare, for example, were you able to make meaningful changes in your lifestyle in addition to treatment? But I wonder if it comes up, diet, once you are diagnosed, or if the doctors just, don't want to confront you with that, then they have to treat it. But Dr. Zhang, I'll start with your, and listeners, 212-433-WNYC. I should end that invitation with the phone number, shouldn't I? Call or text 212-433-9692. Dr. Zhang, your 2022 study is one of the most cited papers linking ultra-processed foods to colorectal cancer. I see you followed more than 200,000 healthcare professionals for over 25 years. So tell everybody briefly, what were you looking for and what did you find?
Sure. So in that study, we were trying to answer a question is, does eating more ultra-processed food increase the risk of colorectal cancer? We know that ultra-processed food make up a very large part of American diet. And there's growing evidence, linking these foods to a range of health issues like obesity, diabetes, heart disease, and premature death. So at that same time, that colorectal cancer is one of the cancers most strongly influenced by diet. We already know that higher intake of processed meat and lower consumption of fiber and whole grains increase risk of colorectal cancer. And many ultra-processed food tend to reflect those patterns, Many ultra-processed food contain processed meat and the low in fiber. So that really motivated us to look at this question in a large, long-term study. And we followed more than 200,000 men and women over about 25 years. And what we found is that among men, those who consume the highest amount of ultra-processed food had about 29% higher risk compared to those in the lowest intake. As you said, we didn't find the same association in women. And also, I want to notice some differences in the type of ultra-processed food. For example, the higher consumption of processed meats, those are hot dogs, sausage, deli meats, and sugar-sweetened beverages, was linked with higher risk in men. And in women, we saw higher risk related to certain ready-to-eat mixed dishes like pizza. On the other hand, we found some foods like yogurt were actually associated with a lower risk in women.
Even though you consider yogurt a processed food?
Well, it depends that what type of yogurt. So the yogurt that just plain, right, just made of milk and cultures, they're not considered ultra-processed. They're considered to be minimally processed. However, the yogurt with added sugar and other additives like stabilizers, they are considered ultra-processed.
So this study, and by the way, folks, it was published in the British Medical Journal in 2022, if you ever want to look up the actual thing, but it found the strongest cancer association was with a specific category, and you were starting to get into it a minute ago, and I'm going to ask you to talk more about it. Meat, poultry, and seafood-based ready-to-eat products. So that's not to say all meat and seafood and poultry, but certain kinds of packaged meat and seafood and poultry processed foods, packaged foods. Can you describe what those are specifically?
Correct. Yeah, those are, as you mentioned, those are not all, right? It's the processed products, bacon, sausage, deli meats. Those are the major types of the processed meat in this category.
What's the mechanism? Do you know? What about those increases somebody's risk of colorectal cancer?
Yeah, there are a few biological mechanisms can help explain that link. And one is that processed meats contain preservatives. Those are nitrates and nitrites. They can turn into compounds in our body that are known to damage the DNA. And that's an early step in the cancer process. At the same time, these meats, especially those made from red meat, they contain a type of iron that trigger the chemical reaction in the colon, and they can produce substances that can irritate and damage the bowel lining. And then there's also how these foods are prepared. Smoking, curing, and cooking meat at high temperatures can create additional chemicals that can also damage the DNA in the colon cells. So when you put all these together, the colon is essentially exposed to a mixture of the DNA damaging compounds plus ongoing irritation inflammation. So over time, that creates the kind of environment where cancer is more likely to develop. There's also newer research looking at looking at other things that people talk about, right? What are the things people added to ultra-processed food, such as additives, and could also be the chemicals contained the packaging of ultra-processed food, and also could be the things that are formed that during high temperature processing. And these have been actively, I feel, investigated, but still evidence still limited. So with that, I would say that we still don't know whether there's clear evidence linking these additives or packaging chemicals to the cancer development in the colon and rectum. I think I feel those new mechanisms needs to be further studied.
Mm-hmm. Santos in Park Slope has a question, I think, about what he can eat in the meat categories that you were describing. Santos, you're on WNYC with Dr. Zhang. Hi.
Hi. Good morning. Yes. Are any of the lunch meats and lunch foods like sliced cheeses, cheddar, Swiss, are any of the deli meats safe to eat?
Yeah, I think that for the cheese, right, you mentioned about the cheese, also depends on the processing. And if the processing level gets to the ultra process where those are the things that having the additives that highly processed, industrially processed, that gets to the ultra processed food category. But some cheese not considered to be processed rather than ultra processed. I know it's hard to make that distinction, but if we look at the ingredients, if you turn the package of these foods and look at ingredients, that the ingredients that you saw, that's something you're not familiar with, that are more likely to be ultra processed. So I would try to stay away from the ultra processed category of the meat.
We have a couple of questions coming in from listeners in texts about the multifactorial nature of colorectal cancer. One listener writes, what do you believe about other factors that often go with eating ultra-processed foods? For example, less activity. Oftentimes people who eat processed foods cook less for themselves. Therefore, you can assume ingredients are less quality. Another one says, a lack of fiber is often considered one of the worst elements of ultra-processed foods. Please ask the doc if adding lots of fiber to a diet high in ultra-processed foods would help ameliorate the risk. What do you think about either of those?
Yeah, I think that's a great question. Diet is complex, as the audience asked. It's not just one diet, right? It's not just one ingredient. So indeed, most of the ultra-processed food are low in dietary fiber. So there are healthier categories of ultra-processed food high in fiber, like whole grains, right? So these might be the healthy version of ultra-processed food. Just like in our study that we look at different types of ultra-processed food, find differences. It's also possible that certain subtypes of ultra-processed food are healthier. They contain high amount of fiber than the other ultra-processed food. But I also want to just also be careful that some ultra-processed food, despite their whole grains or high in fiber, they could contain high amount of added sugar. So I think that we want also to pay attention that just not one ingredient, but the overall quality of that food.
On sugar, we know sugar can contribute to obesity. You described some of the mechanism before by which processed meats might cause colorectal cancer. How does sugar?
Yeah, I think that's first thing I want to clarify, right? Between sugar and colorectal cancer is not as simple as like sugar feeds cancer cells, because all cells in our body, healthy cells and cancer cells, use sugar for energy. So eating sugar does not directly send fuels to cancer cells or make cancer grow in a direct way. But I think what cancer does is through weight gain, obesity. We know that obesity is an established risk factor for colorectal cancer. In fact, 13 types of cancers are linked with obesity. So that excess body fat creates a biological environment that favors cancer development. So I think for the link between sugar-sweet beverages, which we found, right, sugar-sweet beverage consumption increased risk of colorectal cancer is likely through increasing the risk of obesity.
Another listener says her stepdad has colorectal cancer and he's been vegan and active his whole life, so it doesn't always have to do with what you eat. It's sometimes unpreventable. And we shouldn't underestimate the role of genetics in colorectal cancer, correct?
True, yeah. Nearly all the diseases has this gene and environment, right? Both composition that contributes, and sometimes the interaction between the two.
Tell me more about the gender differences, because I see your 2022 landmark study found that men who consume the highest levels of ultra-processed foods, I think in that case it was mostly those meats and packaged seafood products, had a 29% higher risk of developing colorectal cancer, but not so much in women. Tell us more.
Yeah, that's a great question. I think that the honest answer is that it's likely a combination of factors, and we don't fully understand yet. So in our study, as mentioned, we saw our clear association in men, but not overall in women. I think there's possible explanations. One possibility is that men and women eat different types of ultra-processed food, even that they eat the same amount. So then the overall association can look different. And also that the risk of colorectal cancer itself differs in men and women. Men had a higher risk of colorectal cancer than women. And the hormones like estrogen may have some protective effects in the colon for women, but not in men. So these biological differences could influence how ultra-processed food affect the risk of colorectal cancer. And there's also differences potentially in how the gut microbiome interacts with diet that differently by sex. So I would say that the takeaway is not that ultra-processed food, I won't say it's safe for women, even though we didn't find association there, right? But it's that the relationship's more nuanced, and I think we need more research to fully understand such a sex difference pattern with regard to ultra-processed food.
Christine in Westchester was calling about specifically this. Christine, I'm curious if Dr. Zhang just answered your question or if you have a follow-up.
Thank you so much. She did answer the question. I think my follow-up is that, do you think that more research will be done onto that and, linked to that, the increased amount of young people? I'm a young person who's recently diagnosed. And just thank you for bringing attention to this, and will more be done to find out those risk factors?
Thank you, Christine.
I think sorry.
Go ahead, Doctor.
Think that, this is the great question you ask, because there's another paper published looking at adenomas, those at the sort of the early stage of colorectal cancer, right? Our study is looking at the risk of developing cancer itself. But in that study, that they did found that ultra-processed food consumption is associated with a high risk of adenomas.
The adenomas, we often call those polyps, right?
Correct, that polyps in women under age 50. Right? So I think those two things, like polyps and cancer, don't always line up perfectly. But in younger population, there are often enough cancer cases yet in that study to detect a clear association, even if the process has already begun. So I think it actually adds an important pieces of the puzzle. It may suggest that ultra-processed food may be playing a role early in that age, right? It lines with the broad concern as our audience that you just mentioned, that we are seeing the rising cases of colorectal cancer diagnosis at a young age. I think for which diet and lifestyle factors could be especially important.
Before you go, and we bring on former FDA Commissioner Dr. David Kessler, who's on a campaign now to get more regulation of certain ultra-processed foods. One of the goals of these health convenings that we do is to inform me and my colleagues at WNYC and elsewhere in the media about the science of the topics that we do these specials on. So is there anything you would identify that journalists either do well or not so well when covering ultra-processed foods, or anything you would like to see in the journalistic space on the topic of your specialty?
With regard to policy specifically?
With regard to reporting, what would you like to see in the press about this beyond what we already do, if there's anything?
Yeah. I think would be it's more maybe for the research perspective or policy perspective. To me, I feel that it's really hard for individuals to change what we eat, because ultra-processed food is everywhere, right? Like more than 50%, half of the calories that adults consume ultra-processed food. So I really think it's important to have policy level changes. That is important to help the general public, that all of us to recognize or what are ultra-processed food to make healthy choices, but we need tools, we need policies to help us to make that informed choices. I think that you're going to talk more about the policy, what could be useful, that helpful for the public to reduce the ultra-processed food consumption. So I think that would be important to hear more in the future in order to really to reduce the diet-related chronic diseases that attribute to ultra-processed food consumption.
I definitely hear you. Thank you for that recommendation. We will take it very seriously. And we thank Dr. Fang Fang Zhang, cancer epidemiologist and chair of the Division of Nutrition Epidemiology and Data Science at the Friedman School of Nutrition Science and Policy at Tufts University. Thank you so much for joining our health convening today. This was really informative, I think, helpful to a lot of listeners and journalists alike.
Thank you. I'm glad to be here. Thank you, Brian.